Is this in any way getting better or worse? What's the curve look like to you right now?
Well, good morning to you. What we are seeing is that this pandemic is accelerating as we see more people getting infected in many parts of the world over wider geographical areas. So it is definitely of a big concern if we see that more and more people need hospitalization and countries are getting into very strict measures that try to prevent the virus. However, as you have said, some countries have managed with a strong public health measures to curb down the epidemic and get to the point where they have almost zero new infections. So that tells us that it is possible to control COVID-19, and if countries act fast and strongly in trying to isolate people who are sick, making sure that they get necessary medical treatment, and try to go after the virus aggressively, it is possible to have good results.
Are you seeing the amount of social distancing now that you are happy with? I mean, are enough countries shut down that the WHO thinks we can get out of this pandemic?
Well, let's just try to explain to your public two different approaches. One is to try to aggressively go after the virus, to see where the virus is, to try to find people who are infected, isolate them, treat them, test people who were around them, and in that way really try to stop the transmission chain of the virus. This is containment. Now, many countries are now in the situation where there are so many people who are infected that it's difficult to identify those transmission chains. And in that situation, your only option is really try to slow down the transmission. And when we talk about physical distancing between people, when we talk about avoiding mass gatherings, closing events, that's basically to try to slow down the transmission. It has its role. It can help, especially it can give some time to health system and hospitals who are quite often overwhelmed right now to try really to slow down the transmission. But in itself, it's not enough to stop really the spread of the virus.
What about the importance of testing, Tarik? I mean, China and I know South Korea used testing aggressively to get the spread under control, and yet the U.S. And Germany don't seem to even have enough tests at hand to give anyone other than the president and the chancellor maybe a test for the coronavirus. Is that a concern to the WHO?
Well, obviously, the lack of any necessary material to face this outbreak is of a concern, and we have been working really from the beginning of the outbreak to see how we can increase the availability not only of laboratory testing but personal protective equipment. Also do some training for health workers, trying to get medical kits. WHO has shipped 1.5 million laboratory testing kits to more than 120 countries. What is really important is that what I was saying about going after the virus itself. So testing is the key. The testing is really important because that tells you where the virus is and who actually is carrying the virus. We are working with a number of producers. The issue is that there are more and more companies producing tests, but for us to basically vet those tests, there has to be independent evaluation. We are doing really what we can to try to quickly increase the availability of qualified tests so all countries can do as much testing as possible.
How quickly can we find a vaccine to this, Tarik? Is the idea to slow the spread basically and give us time to get a vaccine out there?
Yes, both vaccine and therapeutics. Basically, there is a work on vaccine that is going on, but it will take some time. In the best case, we are looking at about 1 year because you need to find a compound, you need to do clinical trials, because even though we are trying to accelerate the process, you still have to follow a very rigorous scientific process. And then obviously there will be issue for mass production. So that will take some time. The work is ongoing, but it's not for tomorrow. What we are doing, on the other hand, is also looking at existing drugs and see if any of them would be efficient against COVID-19. We are starting this week what we call Solidarity Trial, where we will look at 5 existing medicines and see if any of them would be really good. But that work aside, it cannot replace the work of public health measures that we just talked about, and that's basically trying to contain the virus, or what many countries are doing now, at least slow it down.